So I thought I'd have a little chat to you today about COVID-19 and my thoughts on it. So when I first saw COVID-19, or I'll call it coronavirus, when I first saw about coronavirus, I saw an article on Facebook about a new virus in China. Now I remember laughing at it and making a joke about it being similar to the T virus from the Resident Evil movies, because they were saying they were quarantining people and things like that. So I thought, quarantining automatically equals zombie apocalypse. Do you know what I mean? But yeah, I thought, it's not really anything to be concerned about, because you hear about all these different viruses like Zika and Ebola, and nothing ever came to anything, did it? It was here one day and gone the next. So then I remember watching a thing on the news where the Chinese people in Wuhan were using thermal imaging to detect people with the coronavirus, and I'm thinking, well, they've invested, time and energy into finding the people that are infected, so, there must be some importance in finding people that are infected, I'm trying to think of the word, not importance, yeah, I thought the virus might be deadly, because I heard about that they were building hospitals in preparation for the amount of infected people that they were getting. So I'm thinking, this might be a serious, contender. It might be an immediate threat to our health, because especially when everything blew up on Facebook, I started seeing things about cases in Italy and Germany, places like that. I'm thinking it's only a matter of time till it hits the UK, and it did. So for the first few weeks, everyone was just gathering information about this fast-spreading virus, and when the cases started to creep up a little bit, the British government said, right, we're going to go into lockdown. So lockdown was basically everybody stay at home. You're only allowed out once a day, and you're not allowed to meet people, and they gave businesses, money loans, because, businesses would have to shut, etc., etc. They made sure that, everyone stayed in, basically, to avoid spreading the virus. So yeah, as the cases went up and more people died, and you heard about celebrities getting it, and it just overnight became a serious problem in this country, and I'm guessing in a lot of other places, especially when it first hit America. And I remember reading about it, and especially New York City, with the amount of cases they were getting per day. I just knew it was going to be a serious threat to, not just to our national health, but also it was going to be a serious threat globally. And then they declared it a pandemic. So yeah, here we are, 6 months later. Well, not 6 months later. Well, about 6 months later, I'd say, from when it all blew up, and cases in the UK are rising. Now, we were all told to start wearing masks in shops and everything, and they said that would help to stop the spread of the virus, but originally, even in the lockdown, you didn't have to wear the masks. It was it was your choice whether you wore a mask or not. But now they made it mandatory in all indoor places to wear masks. So you're thinking, right, if everyone was wearing masks, and shouldn't there be, a decrease, a sharp decrease in the number of cases? But in the last 2 months, even the last 2 weeks, the cases in this country have just soared. Like, it's just been ridiculous. We've had a huge spike. So there's a few restrictions being put back in place. Pubs have to close at 10 o'clock, which I don't find fair at all, because of the fact is, if they were sticking to rules and regulations and everything, then you know, they can help keep people safe, because they're doing the Track and Trace app. Now the Track and Trace app is an app that basically means that when you walk into a building, you know that you've been there. So if you phone the establishment up and you say you've got coronavirus, they would send out a message to everyone that's been in that building at that time that that you need to isolate because you've been in contact with someone that's had COVID-19. But yeah, the pubs closing means the pub owners are losing a lot of the revenue, because a lot of pubs and nightclubs and things relied on nightlife, people who went out at night, the business that they got at night. But yeah, it's even same for a lot of businesses. I mean, the lockdown hit a lot of people hard because hardly anyone went out, you weren't allowed to socialise. So businesses that relied on, people socialising just, took a massive hit financially. And it's just not fair, there are people losing their livelihoods, especially because the government are scaremongering about, stay in your house, and don't go out to, and do anything. And so it's the people that rely on other people for their business, like tourism industries, hotels and, food places and attractions, even cinemas. A lot of cinemas in this country have closed, One brand of cinemas has lost 45,000 jobs. It's just not fair, is it? I understand on one hand you have to keep people safe, you have to, enforce the laws to keep people safe, but on the other hand, by enforcing laws, you save some people, but you damn others, Like, at the moment, the government are just, they're protecting themselves. Like, I'm not going to be one of these guys that's just going to bash the government, but our government has just completely and utterly dealt, they've been useless, they've dealt with it completely the wrong way. The advice, if you look on the government website, is just, it's nonsense, it's like, don't do it, but do it, you don't know whether to do it or not to do it, there's no clear-cut law. So it's a bit of a free-for-all at the moment, and cases are just rising and rising and rising, but, I mean, they've got the testing facilities, but, there's no way that they can, roll out the testing facilities to the wider public. I mean, a lot of people, who are key workers or like working in hospitals need the tests because they're working with people, who are, COVID-19 positive, who've tested positive for the virus. So the idea being is the people who are closest to, to the on the front line against the, the battle against COVID-19, they should get the test first. But unfortunately, they're finding it difficult because, they're asking them to go to testing sites that they, are miles and miles away from people's homes, and people just simply can't get, they've introduced a new law where you can only meet 6 people or something like that, something stupid. It's just, I mean, I just don't get where we go from here. I mean, like, we were all in lockdown before and cases sort of evened off, we still had cases, but, a lot of places in the UK reported, a few cases or even no cases, but now there's a heavy spike in cases. What do? Because if they put the country in lockdown again, people's businesses can't survive again, people still haven't recovered from the few months that we did in lockdown last time, people will go bankrupt, people will lose their houses, people will, I mean, they've even said there's a sharp increase in suicides as well, because people have just lost hope, It's like this with the care homes, the homes for the elderly. They're saying, to protect all the elderly, shut the homes from no visitors. But then the elderly are just losing hope, so, no visitors or anything. So, what do you do, guys, The government say, they pass one law, that means a certain amount of people are safe, but then other people that are affected by that law, could die of it, it's a possibility. You're taking people's money away, people's livelihoods, they've got families to support. But I really don't have the answers, guys. I just know we need to find a vaccine, roll out the vaccines, as quick as possible. But yeah, there's no more money left in the government pot to give out handouts. They could have they've only done it for so long because they could afford to do it up until now. But people were off work and the government were paying the wages because the workplaces were forced to close because the government closed them because of coronavirus. But now everyone's back at work. The government are just picking and choosing whose places of work gets hit and whose doesn't, So it's really 50-50, you could lose your job, or you could have your job. It's a scary, uncertain time, I mean, I really don't want COVID-19, but at the same time I don't want to see people suffering because of, laws that have been made that up to now have been pretty useless anyway. Yeah, I mean, it's even in schools. They said it was safe for the schools to reopen. I think they shut at 200 cases and opened back up at, 2,000 cases or something, But yeah, personally, I do think we should keep the schools shut. Just send the work home to the kids. Now I know children have the right to be literate and to have an education, but at this moment in time, to protect the wider working population, to make sure the kids have got a roof over their heads, to make sure the parents can get to work and that the parents aren't affected. We need to let the kids learn from home so they're protected, and like any place that can afford to shut, basically that can afford it with no problems, should be shut. As for starters, teachers can work from homes, plan lessons and stuff. We've got, most of us are fortunate to get internet. They should only open up the schools for those who absolutely need it, like they did at the beginning of the pandemic. But yeah, I do believe in wearing masks too, because 80% of people that test positive don't have any symptoms. So I could have it right now and not know, and I could pass it to 10 other people, which could pass it to 10 other people, which could pass it to 10 other people, and so on and so forth. So if you don't pass it on, yeah, your immune system fights it. In 2 weeks, you get rid of it. You don't pass it on, it stops the spread of it. You know what I mean? By stopping the spread, we can stop it spreading to the vast population. I mean, I think it's 500,000 cases it's up to now in the UK, which doesn't sound a lot, but if the virus is left unchecked, all 66 million of us could have it. But yeah, I'm just praying for a vaccine now. Once we all get vaccinated, it's back to business as usual. But I read today there's either 140 or 240 different vaccinations in trial, so let's just hope that at least one of those works. But I've even heard that it's dangerous to have the vaccines, the trial that they were doing for the vaccines, people were getting injured and sick, so it's just as deadly to be involved in the vaccination trials as it is to get the virus itself. But make sure you're doing your bit, guys, staying healthy, eating healthy, exercising, so that if you do get it, your immune system can fight it off. And if you can afford to stay indoors, guys, this is not me saying, stay at home, protect the key workers and all the rest of it. Now, this is just me saying, guys, protect yourselves, protect your family, protect your friends, your loved ones, I'm not saying don't see your friends, I'm just saying be smart about it, don't, make space for people, try to keep away from people, wear your mask when you're supposed to, wash your hands, just practice basic hygiene, it's all we can do as the general public, is just basically be clean and, try to, stay safe. But, if that's all we can do, then that's what we gotta do, guys. It's better than nothing, but yeah, a huge thank you to all the key workers, the doctors, the nurses, the people who were, the retail staff that have kept open the supermarket so we can have food, the food delivery lorry drivers, council workers that have, collected the bins and everything, people who are still working, even though, there's a threat to their lives. So, you guys are real heroes. But yeah, even the president got it, Donald Trump, so, and he wasn't taking it seriously. So, I do believe we need to take it seriously, but we need to look at what's best for everyone instead of what's best for certain people. It seems to me that, only the rich, can afford to survive this pandemic. They've got plenty of money to wait it out, Unfortunately, not many people will see the end of the vaccine, At the end of not many people will see the end of COVID-19. Well, a lot of people, will just simply give up hope and take their own lives. It's a sad fact, but it will get better, guys. If we look at throughout history, everything ends. Everything ends. The Spanish flu that ended. And people back then didn't have half the technology that we have now. So, we're in a better advantage. We've got a fighting chance. So yeah, just stick to the laws of your stick to the laws. That are put in place. Stick to the restrictions. And do your part. If we all do, our part and do what we can, then, we should be. It should be quicker in getting to a solution to all of this. But it really is the worst of times at the moment. So, yeah. God bless whoever makes that vaccine. It's much needed. Yeah. But I've actually known a few people who have had COVID-19. My godparent, she had it. She picked up COVID-19 working in the care homes. It took her a few weeks to recover, but she tested negative. So you can recover from it, guys. If you keep yourselves fit and healthy, and you've got no underlying health conditions, then you will recover from it. But if you have got a health condition, or any diseases or anything like that, or a weak immune system, keep yourself safe, guys. Okay. We should protect the most vulnerable in our society. We should protect the most vulnerable members of the public that have got like COPD, lung problems, cancer, things like that. Don't forget, guys. Don't let it put you off from going to the doctors for other health problems. Because people weren't going and they were getting illnesses and diseases like cancer, and they weren't getting checked out and they weren't getting treated. So people were dying and suffering prematurely. So get yourself down the doctors, guys. And make sure you're still accountable for your own health. That's what the doctors are there for, to still help us. Okay. Even a doctor from one of the TV programs that I was watching, he said, "Don't be afraid. We're still here. We're still treating other things besides COVID-19." So yeah. Not a lot else to say about it, guys. Other than I do hope one day I'll be making a video about the solution to COVID-19. I hope I make a video and I mention the vaccination. I certainly hope one day I mention the fact that I've got the vaccination. So yeah, make sure you're looking out for elderly members of the public and your family members. They're the ones who need to isolate the most. To really reduce the risk. So yeah, and also don't be having parties, because yes, I'm one of these people that do believe we should be able to meet our friends and things like that. We should be able to have freedom, but at the same time is don't be silly about it. Don't be an idiot about it. You're gonna spread COVID-19 to 100 people just because you wanted a house party. Save your house parties until the end of this pandemic, and then we can all party. We can all be vaccinated and party until our heart's content and have something to celebrate. So yeah, even if the little bits that you do now, you're protecting other people. So even if you're you don't matter and you think that what you do doesn't matter, it does. You know, you can save other people's lives and give them a chance, you know, to live and see their families again. So yeah, make sure you hang tough, guys. It will get better, and I'm always here if you want a chat. Just post in my comments, and you know, I'll get back to you. So thanks for tuning in, guys, and until next time, hit the like button and smash the hell out of the subscribe button, and I'll see you all very soon.